I can get in the mouth and release oral tension all day long. I can teach parents to do it all day long. But the second they go into a feeding position and they're staring at baby with the bottle with this like stress and anxiety and maybe anger and frustration, right?
Yeah.
And sadness about whatever that journey is for them.
Yeah.
Baby felt that. And they're already back to intaking all that air and being dysregulated and not being able to focus on the feeding aspect of it.
I love this because you are literally hitting the true definition of holistic. And I say this because sometimes people throw that in as a buzzword, and as a true holistic provider, as an osteopathic physician, you are connecting the mind, body, and spirit, right? We have to understand, and you said it perfectly, how much of our body language affects everything contagious. And I cannot stress this enough, not to shame parents, but so that they can be cognizant and aware. Because I think you're doing the same thing, that if you are like this, trying, like people on my YouTube watching, like you're tense and you're like, okay, just feed. Your baby is not going to relax because you're not relaxed. If it's like, it's anything we do in parenting, we need to model whatever we want for our children. And that's the only way they have a shot.
And it's not to say, okay, you're the only problem, because baby has all of these things going on, right? But healing that connection is the first step. And I don't care how you heal it. It doesn't matter to me. Do you need to get in the tub and feed your baby?
Yeah.
I'm fine with that. It doesn't matter. Do you need to go for a walk while you feed? Let's figure out how to do it. That helps you get into your state, because you are the co-regulator, right? And co-regulation happens both ways, in the negative and the positive.
Hello, I have Mallory Roberts, speech pathologist and craniosacral therapist, owner of The Feeding Mom, and on social media as The Infant, so at infant.feeding specialist. And we're talking about infant reflux, exploring craniosacral therapy, other solutions before going to medicine, and just getting the real deal on reflux. Thank you so much for joining me today again, Mallory.
Yes, I'm so excited to be here.
Yes, and I say again because I had technical difficulties earlier this year recording podcasts, or maybe it was late last year, and I had to re-invite a handful of guests. And that's always a bummer when you're a podcast host, to have to make people take another hour out of their day to record with me. So thanks again for doing that, Mallory. This is part 2.0 of our conversation.
Yes, it'll be better than it was before. So.
Yes. And how are you? So tell us more about yourself, how you became the infant feeding specialist, and also your passion for craniosacral therapy, and a little bit about what that is too, if people are not sure about what that is.
So I am a licensed speech pathologist, and I have always been sort of dysphagia or swallowing disorders has been my specialty. I actually started in a nursing home. Love the geriatric population. They are just amazing. And life happened, ended up in a pediatric clinic. Never wanted to work with kids, didn't even want my own children. And it changed my life. And so I'm there, and nobody's treating these swallowing disorders for that population. So I sort of dove in with an occupational therapist. We created a feeding clinic, and then I had my own children, and it changes you. It changes how you practice when you have your own children. And so I sort of combined the two, and I was finding holes in feeding, not just therapy, but how to feed a baby. And it's kind of sad, because so many people will say, well, you just feed them. It's supposed to be natural, right? It's supposed to be this thing that you just know how to do. But if you don't, I think we often forget, we talk about these villages, and you're supposed to have your village. And if you grow up and you don't see people feeding a baby, how are you supposed to just innately know how to do that? And so we don't live in the same world that they did back then, when you could just have these skills because you've watched your parents or your grandmother or your aunts do these things, right? And so there's gaps in education for basic feeding. And as we evolve and epigenetics and things change with our systems, and we realize more than we knew before, we need education. and
Yeah.
it's not there. So I kind of combined my speech therapy background with my parenting background, and I became the feeding mom. And so while I have all of this knowledge on dysfunction, right, a lot of my work is habilitating. It's not rehabilitating
Yeah.
anything. It's creating these positive experiences and getting in the body and the mouth early on so that we can move better from the beginning.
Ah,
Um,
yeah.
and then craniosacral therapy came because it's amazing.
It is
And
amazing. Yeah.
because I'm a therapist, I
Mhm.
always focused on the motor and what I can see and what there's a this dysfunction and here's the solution to that dysfunction, right? But these families would go home and I'm like, oh, they're doing great. This is the progress we're seeing, and there was this lack of like carryover. I'm like, what is missing from when I feed the baby to when they go home in their natural environment and parents are feeding the baby? And craniosacral came into the picture. I don't know. It was like a God thing, right? Like, this is what you need to do. And it changed my whole career. It changed my
Mhm.
whole perspective, like motherhood, being a wife, and how I treat these babies and how I can help these families.
And we'll get into more of what exactly it is when we talk about reflux, because
Yes.
we're going to talk about reflux. But
Yes.
I am an osteopathic physician. We learn about craniosacral therapy. This is part of our training. We learn about other interventions besides your traditional allopathic medications and things like that. And that is why I really gravitated towards you, because I am a clinician that truly believes in that holistic approach to diagnosing, treating patients, including our very littlest patients, which sometimes doesn't happen. So, when it comes to reflux, we have causes and etiology. What do you think is missing in the traditional evaluations of reflux? And I'm okay if you discuss traditional medicine in a way that's not the best. That's okay. But what do you think is lacking in that evaluation of reflux, especially when we discuss it for newborns and infants?
I think I think what's lacking is the multidisciplinary aspect of it,
Hmm.
right? Like, point blank. If a person is coming in and they're experiencing reflux, maybe medication is indicated, right? That's
Yeah.
We're not saying that that's
Right.
never a thing, because and we're going to talk about that. There is a point where that is indicated, but it's not always, and it shouldn't be the first, right?
Yeah.
The feeding assessment, like, can we get someone watching baby? And surely your pediatrician doesn't have time to sit with you for an hour and watch baby move and watch them feed and watch your interaction and get down into how they were born. And, that is where your feeding assessment comes into the picture.
Yeah.
So it's not about, hating on pediatricians and saying that they serve no purpose. And
Yeah.
it has nothing to do with that. It's that we need to work together. And someone is struggling with reflux, I'm not going to say it could be as easy, because reflux is so multifactorial once you get into like what the causes are, but it could be as easy as changing their feeding position, right?
Hmm.
And if we can get in there week 1 and make these adjustments for parents and talk to them about routines and schedules, instead of, this is how much you should feed them every
Yeah.
hour, and if it's a problem, oh well, force feed them, increase the flow rate. Like, there's other things we can be looking at besides that. And I think if we can get there, we're set.
Yeah, and do you think so? Me and you know, but explain maybe for people who aren't familiar, how do positional changes have an impact on reflux? Maybe talking a little bit about reflux and why that is something that is a go-to initial thing that sometimes parents are not taught, because like you said, the pediatrician either doesn't have the time or isn't knowledgeable about the different position changes. And so why would that be helpful and as a starting point?
Yeah, so a lot of times we're talking about, most of the time, feeding position changes happen with bottle feeding, because when
Hmm.
you are breastfeeding, you have a lactation consultant. You sort of play around with feeding positions, making baby comfortable, right? But feeding position for bottles, people immediately go to the cradle feed, right? Cradle baby, and you feed them. Um, and that really takes away baby's control of the feed. Okay. So the bottle is coming down towards their mouth. Um, they are they are not in control of that suck, swallow, breathe pattern. They are having to keep
Yeah.
up with what they're given, right? Um, Bottle fed babies aren't given opportunities to pause
Hmm.
and break. And that impacts their regulation. Okay. So if from like this like basic level of why they would be having reflux, if we're just giving them the bottle and they're suck swallow suck swallow suck swallow suck swallow, and they're not taking those pauses and they can't regulate, then we're immediately looking at, okay, are we overfeeding? Because it can, and a lot of times reflux looks like so much more than it
Hmm.
is, right? Like when they're refluxing, it's probably 5 mLs, right? But when it comes out, you're like, oh my god, it was half the bottle. And so if that little bit that they could have paused and regulated their intake a bit and pulled away when they wanted to, it could have been the difference between a reflux event and a non-reflux event.
And you mentioned obviously being able to see the dynamics of feeding as part of, the evaluation. What would be for you in an ideal world a more holistic approach to diagnosing and treating reflux?
I mean, I would want, so really, pediatrician, they come in, oh, I think my baby, they're spitting up a lot,
Yeah.
right? They're having reflux, they're in pain. Okay, here's a person to go see for a feeding assessment. Done,
Yeah.
right?
Yeah.
Get the
Yeah.
feeding assessment. Maybe she sends you back for medication, right?
Mhm.
Maybe that's in y'all's plan after you discuss or you treat for a while, right? Because we certainly don't want babies in pain. That
Right.
is not a goal for anybody. And that's what reflux medications do. They can help with pain management of reflux. But the reflux event is still going to happen.
Yes.
And
We'll talk about
so,
that. I don't think people
yeah.
realize that. Yeah, yeah. Go ahead.
And so yeah, that's it, right? Get the
Yeah.
feeding assessment. Get your feeding assessment and bring in who you need to bring in as secondary pieces.
The amount of people that are shocked when I tell them that the goal of the reflux medicine, because I actually do not prescribe a lot of reflux medicine because I do what you do. I take a holistic approach.
Yeah,
We don't have a lot of craniosacral therapists in our area, but I refer to Early Steps, which has a feeding therapist, and they do
yeah,
all this stuff. And that is my protocol because I'm like you, that I do believe that we're going to manage this low intervention first. And what I
yes,
mean by that is medication to me is not a bad thing, like you mentioned, but it is my last resort in anything I do in pediatrics. Like literally anything you tell me, I'll be like, we're going to talk about everything else before we reach for a
yes,
prescription pad. But I will say that I have had those situations where the acid reflux is causing them so much discomfort. They're arching, they're having these, aversions because literally their acid production is so bad. And yes, the PPIs or the medications we use for reflux can help the acid pain, but like Mallory said, they can still spit up because the reflux medicine is not stopping the spit up per se. It's helping stop the discomfort. And I think this is so important because a lot of clinicians do not talk about that when they prescribe medicines. And then I get them in my office for, hey, I saw another doctor and they started me on this reflux med, but the kid is still spitting up. And I said, well, the kid's getting weight. The kid, how's the feeding experience going? How are they swallowing? All that stuff. How is, the discomfort? And they're like, oh, that's all better. Like everything's actually really improved. And I was like, this is wonderful. But again, it's understanding what medications do,
yeah,
understanding, like you said, what is the dynamic and experience with the feeding session, which as a mother who had a second child who did not feed well, like I've been vocal about this. Vera was a very difficult feeder, breast, bottle, like not even just spit up, but she just was very like her
messy.
tongue messy,
Hmm.
dribbling, a lot of issues. And it got better and I didn't need to go to a feeding therapist, but I was so close to making that appointment. And I say that because it shouldn't have to be this unenjoyable experience, which I think what
Yeah.
happens is pediatricians, not all, will say, well, it's kind of what it is. It's just they'll outgrow it. But then
Hmm.
parents are starting to feel stressed with the feeding experience. And that's not good for anybody, as you and I both know.
Yeah. Yeah. And and that, like, you made a good point. They'll outgrow it, right? And I feel so strongly about that because they're not outgrowing anything. We
Mhm.
don't outgrow pain and discomfort and dysfunction. We compensate and we grow into other things, right? So
Mhm.
a baby is a perfect example of that. And whatever the root cause, right, your root causes of reflux is, it's still there. It just manifests in different ways as they get older. And I think that's really important for parents to hear too, because as they start to see other problems come up, in my when I first started with pediatrics, we were seeing 2 and 3 year olds, right? We weren't seeing infants yet. And, I would ask, okay, how was infant feeding? And they're like, oh, it was fine. And then they always say that, right? You turn off all the trauma in your life and you're like, oh, it was great, even though it was like a complete disaster.
Yeah.
And, and so I'm like, oh, okay. So did they have any reflux or spit up? Oh yeah, it was awful. And then you get down into this rabbit hole of things and you're like, okay, well, this isn't, your baby doesn't just have picky eating, right? It's not that they
Yeah.
can't eat ground meat right now. It's that they couldn't move their motor functions way back in the day too, right? And it just builds into different things.
Yeah.
Okay. So your adult who has sleep apnea, if you go all the way back, go ask your mama, you probably had reflux and it's just been building.
And so for you, when you're evaluating a family, and I love that you also take that approach, right? You're like, you're not dismissing meds, you're not dismissing pediatricians. Thank you,
Yeah.
because I love that, and that's not what obviously I would never do that as well as a pediatrician, but also for my colleagues in speech and feeding, right? I think
Yes.
that's why all of us need to be on the same page of like pediatricians respecting our subspecialists like you, and then obviously everyone else respecting us. So for you, when you're evaluating a family, what are some red flags for you for reflux? Whether it's something like, hey, y'all need to figure this out, or we need to do something more. Or what would those red flags be?
So most of the time, so there's like two categories, right? They're either coming to see me because they know they have reflux, right? It's obvious, it's there. Most of the time, and those red flags would be, they are physically refluxing. Yes, they're frustrated. They have the clenched hands. They have the clenched hands, um, and it's just obvious.
Yeah.
The ones that come to me, um, who are, they're like, I don't know what's going on. They don't like to eat. They're messy eaters. They're lazy eaters, right? The ones that are diagnosed of something else besides reflux, when you're watching them, the silent reflux events can be, um, once you see them, you're like, oh, wow.
Hmm.
So, like your red flags, arching your back is a good one. So
Yeah.
if they're in the middle of a feed or almost done a feed and they start arching their back, right? That is that they're probably actually experiencing a reflux event in that moment. Um, but after the feed, bubbly saliva coming out of the mouth, right, can indicate reflux.
Hmm.
Um, if they're smack and swallow, right?
Yeah.
A lot of times they're like just randomly laying there, and all of a sudden they'll start smacking and swallowing. And I'll say, "Do they do that often?" Parents are like, "Oh yeah, they do that
Hmm.
all day." Okay, they're refluxing. That's a reflux event. What are they smacking and swallowing?
Yeah.
They're not eating anything,
Yeah.
right? And so those are like the red flags that I watch for silent. I think reflux, your red flags. Um, when it's overt is pretty in your face, right?
Yes.
Although I will say that sometimes when you're a happy spitter, right, they get dismissed a lot because they're not
Hmm.
experiencing any pain, but they're the spit up, because if they're not experiencing pain, most of the time they call it spit up. If they're experiencing pain, then they call it reflux.
Yes, agree with
If
that
something
terminology.
is
Hmm.
if something is coming out of the mouth, you're refluxing, right? It's coming from it's not supposed to be doing that. So you're refluxing something. Um, and so a happy spitter can get dismissed. So if baby is spitting up, we have to know why.
Yeah.
If they're doing it all the time. If your baby does it once a day because grandpa decided to throw them in the air after they were done a feed, probably okay, right?
Yeah.
But if you're seeing it after every feed and throughout their wake windows, or it's waking them up, right? That's a red flag too. They're waking up screaming.
Yeah.
Babies should be waking up rested and feeling good, not waking up screaming.
I love that. I mean, that is exactly what I advise families. And I think another narrative that's often told is, going along lines of the happy spitter is that so a family comes in and is like, my baby's spitting up. And then the clinicians will look at two things that, okay, the baby's gaining weight and that the baby is not bothered by it. And
Yes.
so those two things tend to be like, okay, well, then we'll outgrow it. But I know you also agree that there's more to that picture as well, right? Because in your opinion, you would want to also focus on functionality and how the baby's feeding. Is there anything else that you would want to add that should be evaluated in that situation where a baby is growing fine, but also and not bothered by it? Should we be evaluating anything else in that spit up situation?
Yeah, like as a first line or like as a therapist looking into the whole picture?
Hmm. Yeah,
Both?
like yeah, both. Yeah, yeah,
Like as your first line, like if you are the pediatrician and you're like, "Oh, but they're happy and they're gaining weight and everything seems to be fine." I would first say, "Well, is everything fine?" Because the parent would have brought it up if it wasn't fine,
right. They
right?
wouldn't have
Like
said
they
anything.
wouldn't have said
Correct.
anything at all
Right.
if it was just normal to them. So if they're like, I don't know, they're spitting up more than normal, and you say, okay, weight's fine, and they're happy about it, um, what else can we look at? How are they sleeping?
Yeah.
Okay, because that's a big one because sleep is connected to feed. It's all connected. Um, okay, well, they're feeding. I mean, they're sleeping great. I mean, I have no problems with sleeping. Okay, well, how are they breathing?
Hmm.
Are they breathing with their mouth open? Do you see a lot of drool coming out? Because a
Yeah.
newborn shouldn't be drooling. They're not teething.
Hmm.
A 2-month old's not teething.
Right.
And so excessive drool can be a red flag. And we want to look at those things early because if we can give simple movement into these muscles and habilitate them early and prevent open mouth breathing, long face syndrome, right? Where we're not getting that good palate widened. Um, that's your airway. We can be looking at airway too. So it's not just feeding, it's sleep, it's regulation, it's airway. We have to have a question regarding each of those areas because that's what the mouth is in control of.
Oh, thank you so much. I know that
Yeah.
obviously that's kind of what I was wondering if that's what you would say. Obviously, as my guests know, as my listeners, as my listeners know, I don't know what my guests are going to say when they're on the show, and I'm like, are we going to get into that angle of like the mouth? And of course, we did. And that brings me to craniosacral therapy again. So I know you obviously talked about that at the beginning, but explaining it in a way, maybe saying like what exactly is an evaluation and like a sample example of a therapy and why it helps in something like reflux when we talk about the connection of the body and what exactly that is and why it helps.
So craniosacral therapy is you're using the lightest touch imaginable,
Mhm.
and you are creating what I like to say is like you're creating space within the body to move better.
Yeah.
Okay, so and that might sound like the most woo woo thing you've ever heard, but what I tell everyone who looks at me like I'm crazy, I say, okay, if you can imagine closing your eyes and you open a door and the first person you see is your worst enemy. You just wish you've never seen them before. They are the worst person you could imagine. Like everyone has that person, right? They're
Yeah.
mean to you, they make you feel like garbage. So actually do that, right? Like close your eyes and imagine that person and feel what your body did.
Mhm.
Yeah.
Yeah.
Your shoulders come up, your jaw gets tight, your stomach might turn.
Yeah.
I mean, like you have a physical reaction
Mhm.
and they didn't even touch you.
Yeah.
They did nothing to you, but their intention in your body is negative. And so
Yeah.
you have a physical response, right? So then you close your eyes, okay? And you open the door and you're imagining your most favorite person in the world. And what do you immediately do in your body, right? Your shoulders relax. You take a deep breath. Maybe you smile, you get chills, right? And your body opens and releases.
Yeah.
Okay. Again, they didn't even touch you. They didn't have to hug you. The person that you don't like didn't have to stab you for you to
Yeah.
feel those things, right? And so in craniosacral, we're using that rhythm that you have within your body that controls not just emotional, because there is emotional pieces to it, but it controls physical reactions to certain things that happen in your life. Okay. Um, and so in a craniosacral therapy session, like when I'm using it for feeding, I'm using it, I will do my own thing with baby, right? So I'm touching baby and my touch is allowing them to feel space
Mm-hmm.
where they may not have felt space before. Okay. And, how is a newborn traumatized? Have you ever been enclosed in a really tight spot where
And
you
had to
can't
be
move
birthed.
and
Yeah.
then pushed through like
A
with these
tight space.
like, have you ever experienced that as an
Oh,
adult? How could you
man.
possibly say that that's not
Yeah.
traumatic?
Right, right.
And so, like, we need to work within their body and allow movement in
Mhm.
spaces where they may have been stuck in order for them to say, oh, wow, I can move and feel good in this space. And it
Yeah.
does feel safe. And I'm okay, right? Because they stay here for safety, right? If something's going to come and attack you, you get into the fetal position, right?
Mhm.
And so, but if somebody came up to you and lightly stroked your back, you would open up and release that.
Yeah.
Yes?
You're making me release right now. I mean, for people watching this on YouTube, I'm like, I'm getting all loosey goosey here, and
Are
I'm
you
like,
feeling my
oh, I'm
intention?
feeling it. No, I feel it. It's like therapy, my friend. I mean, we talk
Yes.
about this. We talk about feeding is not just feeding; it's
Yes.
emotional.
It is
It's
not just
emotional,
feeding.
and I know
Yes.
this very well. This is all about the vibe that you
Yes.
bring. It's
And
true.
so when I release baby, right? I'm like, and I'll show parents and I'm talking to them and I'm like,
Yeah.
this is what I'm trying to do. And I will speak to the baby the way I want the parents to speak to the baby,
Yes.
right? You are safe. You are free to move, right? Like that's so important. Um, and so I'm speaking to the baby and baby lets go. And I'm like, did you just see that? And
Yeah.
I get excited, right? Like I know it's
Yeah.
going to happen. But every
Yeah.
time it does, I'm like, they allowed me into their safe space. Okay. So we have that. Then I'm going to hand the baby to the parent. And that's when the real work happens
Mhm.
because then I can see parents' shoulders go up and during the feeding and I can see the jaw tense and the stress of feeding and all that it brings when there's a struggle.
Yeah.
Okay? It doesn't matter what the root cause of reflux is if that dynamic doesn't improve.
Love it.
It does not matter because I can get in the mouth and release oral tension all day long. I can teach parents to do it all day long. But the second they go into a feeding position and they're staring at baby with the bottle with this like stress and anxiety and maybe anger and frustration, right?
Yeah.
And sadness about whatever that journey is for them,
Yeah.
baby felt that and they're already back to intaking all that air and being dysregulated and
Yeah.
not being able to focus on the feeding aspect of it. So, my first session is talking to parents about letting go. I don't care if you have to put some headphones on and jam
Yes.
out to some music just to get you to ignore what you're doing for the first, like, ignoring it is better to heal and then you can come back and bond, right? It doesn't, if we have to heal this relationship, sometimes you need to separate it for a bit and then come back to it.
I love this because you are literally hitting the true definition of holistic. And I say this because sometimes people throw that in as a buzzword, and as a true holistic provider, as a osteopathic physician, you are connecting the mind, body, and spirit, right? We have to understand, and you said it perfectly, how much of our body language affects everything. And I love the example that you mentioned of like your enemy versus your friend, and how not even touching you, that the energy, the vibe, like I am such a believer in vibe. Like, and
Yeah.
my husband doesn't believe in vibe as much as I do. And he's starting to understand. And I'm like, no,
Yeah.
no, no. It's a vibe. Like, if there is
Yes.
negative energy around this experience or negative
Yes.
energy around this home, it's going to impact without even doing anything
Yes.
because of the vibe. And it's not woo woo. Like, you mentioned like people may look at you as this being woo woo. It is
Yeah.
human, it's psychology, it's it's energy, and
Yeah.
energy exists, and children, especially babies, exist. And the example I give families who are still listening and thinking that this is woo woo, we talk about like when there's a contagious effect of babies. So if a baby's crying or a baby's happy and all of a sudden they hear someone crying, like my son, my daughter starts crying. Babies in a newborn nursery, when they are all in the nursery, if one starts crying, most of them are going to start crying. Energy is contagious. And I cannot stress
Yes.
this enough, not to shame parents, but so that they can be cognizant and
Yes.
aware. Because I think you're doing the same thing, that if you are like this, trying, like people on my YouTube watching, like you're tense and you're like, okay, just feed, your baby is not going to relax because you're not
Yes.
relaxed. If it's like,
Yes.
it's anything we do in parenting, we need to model
Yeah.
whatever we want for our children, and that's the only way they have a shot, for sure.
And I mean, and how hard is that when you are experiencing postpartum depression or
Correct. And
anxiety,
anxiety around
right?
feeding, which is so
Like,
real. Yeah. No,
it's
it's a
so
vicious
real.
cycle. Vicious
And
cycle.
yeah, it is, and it's not to say, "Okay, you're the only problem," because baby has all of these things going on, right?
Right.
But healing that connection is the first step. And I don't care how you heal it. It doesn't matter to me. Do you need to get in the tub and feed your baby?
Yeah.
I'm fine with that. Like I don't it doesn't matter. Do you need to go for a walk while you feed? Let's figure out
Yeah.
how we do it that helps you get into your state because you are the co-regulator, right? And co-regulation happens both ways in the negative and the positive.
And to bring back the joy to feeding. And I
Yeah.
say this, like my daughter, again, didn't have reflux, but I was so stressed with the amount she fed, which I know as a pediatrician is ludicrous, but I had really bad anxiety after the birth of my daughter, that I was obsessed that she wasn't drinking more, even though she was happy,
Yeah.
sleeping, content. So I would start pushing the bottle in her mouth, knowing full well that I wasn't supposed to do that. What happened? She created a feeding aversion only with me. Not with my
Yes.
husband, not with our nanny, only with me. And I had to then, you said it perfectly, I had to get back into the mantras. You are safe. You are fine. You are telling me that you're done, and I believe you. And I'm going to
Yes.
stop this. And I had to retrain myself and just get that through. And it sometimes took me having to have other people help with the feeding sessions because she was exclusively pumped and bottle fed to get there. And then finally, the feeding experience became enjoyable again. But we
Yeah.
cannot dismiss that, whether it's like you said, real reflux, feeding aversions, all of that, the vibe and what the mantras that you bring to it really matters. And I don't think
Yes.
people realize the psychology that goes into being a parent, because it's
Yeah.
all majority of it is psychology, right? Like how you're
Yes.
approaching it. Oh, so true, Mallory. I love it. Oh man. Okay. So my other question to you is, in those sessions, like when you talk about craniosacral therapy, because again, people may not know, you said it's very gentle touch to the back, to the neck, to the mouth. Describe where you're kind of going when you're doing craniosacral therapy for something like reflux. I know it can vary based on the issue.
Yeah. All over,
Yeah.
right? I'm gonna say something that sounds really woo-woo and say, "I go where the body calls me to go."
Mhm. Yeah.
Right? And so so, like, normally I start with, their feet,
Mhm.
okay? And I just sort of sit, okay? A lot of times, and their spine. I'm a
Yeah.
big spine worker because that is where right, the brainstem is coming out. Yeah, it's just a huge connection point in the body, your spine, right? And, like, I can I can feel where they're just being stuck, okay?
It's a real thing. It's not woo, because as DOs,
It's
we learn this too, guys. This is real. Like we
it's
learn
not like
stuckness. Yeah, yeah.
and, and I love working with babies, like, I can work with adults, but gosh, adults are so hard, and
Yes, because
we are
they're
oh
stuck
my
from a lot
god,
of other reasons, like mental
they are
trauma.
yes.
Yeah.
And it's just
Yeah.
compounded.
Yes,
It
yes.
doesn't matter where you go on an adult, you're gonna find some kind of stuckness
Yeah, true.
because we have these, decades of just, like,
Yes.
holding on to these traumas and physical tension, right? Um, but with babies, I listen to them. Really, I put my hands on them, but they will start to move in a way that shows me what they're needing. And again, I say it sounds kind of silly, but when you're in the session and I tell parents, "Did you just see that?" And they'll move like their shoulder or they'll
Yeah.
turn a certain way. So we're going to go into this space and see what they need to release. And I am a mover. Some craniosacral therapists lay babies down and just sort of a stay, right? And they feel within their body, and they travel with their craniosacral rhythm and find that. I think just because of my background, I like to move them, so I do a little manual release too. So I kind of combine the two, but you'll see me moving the baby. Um, it's just it's the lightest touch, and I say light touch, the lightest, because you can't even imagine how light it is.
Yeah.
It's almost like you're floating on their skin, like you're not even there.
Yeah.
Um, and so, yeah, it's different for every baby. For reflux specifically though, like if I know they're struggling with reflux, I'll of course go into their diaphragm, right? Because that's where your esophagus is coming down into.
Mhm.
Okay. So we're going to sit there and we're going to create some movement. And then I'm going into their intestine, right? Not physically, but in that
Yeah, yeah.
space. And we're creating movement in there because that's where we're holding so much tension.
Right.
Yeah.
No, I mean, the body remembers, right? I mean, we talk about
Yeah.
trauma. Like, I love what you said about the adults because it is true. I
They're
that's why I
so
love
hard.
children.
Yes.
But no, I mean, and I love what you brought up again about the fact that people are like, well, what trauma does a baby have? And you mentioned beautifully the physical process of being born, right? I mean, obviously, we know that is tense, and babies come out really kind of just like you said, clenched hands, just tense. And again, we're just helping them relax into your touch, which I think is
Yeah.
so cool. And I guess my last question for you is I love the work that you do. I've mentioned this multiple times, and I think I love it because I am a holistic clinician, truly, like as a DO. But my struggle in my where I practice is finding people like you, Mallory. So, if someone is interested in a craniosacral therapist, is there like a place that they can go online to find a database, or what's the best way if they want someone in person to do what you do?
Yeah. That's such a struggle.
Yeah,
There's not a lot.
yeah, it's true.
Um, there isn't. And so, Google is your friend. Google in your area, craniosacral therapist. Mom groups can be really good. So they may know someone who does some sort of body work, right? Not limiting your search to cranial sacral therapists, but cranial fascial therapists
Okay.
too. It's a little difference, but they move the body as well. Um, uh, Outside of, like, finding someone to actually touch baby, right? I'm a huge proponent of parents having those skills themselves and learning how
Yeah.
to help baby and connect, okay? So, I have parent guides that teach that. So if you don't have someone hands-on is always gonna be better, right? Nobody's denying that a one-on-one visit with the practitioner isn't the best option, but it's not always available.
Mhm.
And, as a parent, you are there. Like, you can be that release person for your baby. Is it gonna help the other root causes, right? If there's oral dysfunction, well, that's where your feeding assessments come
Yeah.
in, and you can call in other services to help with that. That's where your pediatricians are coming in to help manage if you need that pain management, right? And so don't if you're in an area and you're like, there's absolutely no body workers, right? There's nobody. Some occupational therapists also have movement training like that. Some physical therapists do. So if you're in an area that has pediatric um, clinics,
Yeah.
I would call them specifically and say, "Do you have someone who works with infant feeding specifically?" Because you can be a feeding therapist and work with 2-year-olds and sensory diets,
Correct.
right? And
Mhm.
that's not what we're in a whole different field than that, right? So I'm a speech therapist and I do craniosacral. You can be an OT, a PT. You can just be a craniosacral therapist. So sort of expand your search that way, but also feel empowered enough to learn yourself, like, you can have that touch for your baby too.
And fun fact, I don't buy a lot of courses online because, again, I am a clinician. I only buy courses if I want extra education. And guess whose course I bought?
No,
Yes, I did. I don't know if you know that. I bought it
no,
and I
I
and I
did
wa
not.
yeah, I bought it and I loved it. So I'm saying that because I really do believe in the work that you do, and I think it was wonderful, and it actually inspired me to get to learn craniosacral therapy. I'm always trying to elevate my experience,
Yes,
and I'm a lactation consultant because I really wanted to get better at breastfeeding education. And my husband's like, "Is there anything else you'd like to do?" Because he's always like, "You're always wanting to do something." I'm like, I'm a DO and I would love to get certified in this. And there's pathways through being a DO because
yeah.
we have
Okay,
this.
yeah,
But I did buy your course. And I'm saying that because I do believe it's a wonderful resource. And even like she said, I know, she's mentioning that because it's her resource, but I am saying that I also loved your resource. And I do believe that if you're listening to this and you're like, I really need this approach to support my child, that it is a wonderful thing. And just wanted to let you know that I don't think I told you
yeah,
that,
thank
but
you. No,
yeah, of
you
course.
didn't.
No, I loved it. The oral work, I mean, there was so much about it that I was like, this is great. Like, this is
Yeah.
really wonderful. So we'll attach all those links at the end. What would be your final uplifting message for everyone listening? This is something that I want my guests to give my listeners so they go home feeling loved and empowered. So what is your message for everyone today?
That you are loved and empowered, right?
Yeah.
Like you can, um, it doesn't matter what area of motherhood you're struggling with. Like it's just so much all the time.
Mhm.
Um, but you are loved and you have so much that you're already doing that you don't even recognize, right? um if I could say one thing, I would say that I think everyone needs to have mantras on their mirror.
Yeah, yeah.
um and I want them to say what you need to hear,
Mhm.
and then you look in the mirror and you say them to yourself.
Yeah.
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 So if you need to feel safe, if you need to feel like you are safe and you are loved, and you're going to post that and you're going to look at yourself and you're going to say it. And that can be really, really powerful, um, outside of even just the motherhood piece. But if you're struggling in a specific piece of motherhood, like say it, because you are those things and there is support out there. Um, and if you're in the most rural of places, like that's the beauty of social media these days, right? And virtual and connecting with providers, because we can do that, and that wasn't always an option before.
Yeah.
So you're not alone, and there are support pieces out there for you. Um, and what you're feeling is valid. I don't care what you're feeling. It's all valid, in my opinion.
Yeah. Well, listen, everyone came for a discussion on craniosacral therapy and reflux, and they left with a therapy session. I'm always about that. Okay. Like you literally gave them everyone, like, I'm feeling loved. I'm feeling like, connected. It's awesome. Thank you,
Yes.
Mallory. I enjoyed talking to you the second time. Tell everyone where they can go to stay connected with your resources, that we alluded to as well. And I'll be attaching those to my show notes and captions as well.
So I post so much on my Instagram at infant.feeding.specialist. And then all my parent guides and working with me virtually. And if you're in Louisiana, working with me one-on-one is on my website, thefeedingmom.com.
Wonderful. I will be attaching all of that. And thank you once again, Mallory. It's always a pleasure connecting with you. And I'm sure we'll connect again, either on social or obviously
Yes.
on this podcast again. Thank you.
Yes. Thank you so much for having me.